The vaccine rollout is due to start in Australia next week. How's it going to work and who gets the first jab?
Well, it's a very exciting time to only a year since this virus has hit us all. We have a vaccine that's kind of 4 to 10 years ahead of when we would normally get a vaccine. So a very, very exciting time. The people who are going to get it staged across the year are in order of who you might expect. Those most in need, those who are most likely to get exposed to the virus, and those most likely to get sick, seriously sick, are those that are first. So healthcare workers, quarantine workers, aged care workers, and people in aged and residential facilities themselves. They're first, and then second cab off the rank will be elderly people and so on, and emergency service workers. And this will be staged as vaccine becomes available, and as it can be. It's a logistically very complicated thing, so it'll be rolled out over the course of the whole year in that way.
Professor Crabb, what do you say to people who say our vaccine procurement policy has failed? They point to the delays in the vaccine arriving in Australia. Israel, for example, has already vaccinated some 76% of its population. We haven't had a single jab. There's others that say we've not got the right vaccines. The AstraZeneca vaccine is nowhere near as effective as the Pfizer vaccine, and now there's reports today that we may have a syringe shortage. Overall, do you think our procurement policy has been a good one compared to what other countries have done?
Overall, our procurement policy and our vaccine strategy has been really good. I've said this consistently for a year. This is one of the things, and amongst quite a few, they haven't got everything right, but they've really got the vaccine program very right. They've taken it seriously from day one. They've given us, this is the federal government, quite a few options. It was very important to have a homegrown option for vaccine security. We didn't know what we were going to be able to get. We didn't know which ones would work and which ones would work well and which ones would be the safest. And so, all things considered, I think that the policy's been very good. We're going to have 3 really good vaccines available to us: AstraZeneca, the Pfizer vaccine, which is here already to some degree, and then coming along the middle of the year, the NovaVax vaccine. We'll actually have even more through the COVAX facility available to us later. So I'm very happy with the procurement strategy. We're not in the same boat as Israel, the US, the UK, and other European countries. They're in an emergency. They have special use for vaccines, special approval for vaccines under that emergency regulatory framework. We don't have that. We don't need that. So our regulatory authorities that are top class are able to assess it under normal circumstances to make sure that everything is happening in the right way. We don't have any COVID in Australia, of course, and so there isn't the same urgency. There's urgency, but there's not emergency. So we're in a very strong position as far as vaccines are concerned.
But there is some would argue, very much an economic emergency, and that we should be rolling out this program as quickly as possible so we can open up the country again. At what point will we be able to open up the country? At what point this year will we achieve herd immunity?
Well, I agree with that. It's just a time frame thing. Whether it's a month here or there, this is an immunisation program that is going to take the best part of 6 to 12 months. So getting it right is very, very important. I do agree there's urgency, and there's economic urgency for the reasons you've just mentioned. But remember that we're not going to achieve herd immunity even this year. Children aren't even going to get vaccinated. There's no vaccine approved for use in children yet. That's 20% of our population. So we've got to stage this. We've got to be prepared to roll out the vaccine, yes, as quickly as we can, but appreciate that that's going to happen in parallel with the restrictions we have now, and then the staged lifting of those that makes the most health and economic sense. It's going to be quite a nuanced thing, and we'll have to see how the government handles that. It's going to depend pretty heavily on what information we get about the vaccines. We don't know about their transmission rates yet. We don't know about their real-world effectiveness. We know what their clinical trial effectiveness is. That's very different to their real-world effectiveness. So it's going to be a staged thing over 12 months.
So, Professor Crabb, none of these vaccines will actually stop you from getting COVID. They just lessen the symptoms and slow the transmission rate, it's thought. So that means that at some point we are going to have to learn to live with the virus in the Australian community. What is that new COVID normal going to look like? Will we have to wear masks and have things like limits around public gatherings going forward, in your view?
Well, the first thing is it's not so clear that that the vaccines will still let you get infected with the virus. There's every reason to think that's actually not the case, and there's certainly every reason to think that all of the vaccines are going to be pretty good at blocking transmission. So, you know, I wouldn't say that there's a certainty that we have to live with the virus. We might have to, we might not. We need to understand. We certainly don't want to live with any severe disease, so that's out. We need to learn a bit more about what subclinical disease, illness from COVID, long COVID, effects on our heart and on our kidneys and on our liver and on our brain. We have to learn a little bit more about that before we say it's a carte blanche that we have to live with COVID. What we definitely have to do is go back to a life where we can function, we can travel, and our economy can function normally. There's no question about that. But how that happens is still has to be worked out across the year. We will see major changes by the middle of the year. We'll have our quarantine much better sorted out than we've got at the moment. That's absolutely crucial. We'll have a lot of people protected, and things will start to ease. But there's no magical point at which we're back to pre-COVID, and there's certainly no environment where we must live with COVID. We've still got to determine whether we can do that or not.
Now, just on a different matter, your institute was impacted by Facebook's Fatwa against Australian news sites. Tell us about how that impacted the information you distribute and your thoughts about big tech bully boy tactics.
Well, you know, I run a medical research institute, not-for-profit charity, effectively, and like many institutes like mine, our Facebook page was blocked. So I was shocked at the action Facebook took anyway, but I was certainly completely shocked by that. You know, incredible overreach. You know, what Facebook have is a spat clearly with the government and with other media. Traditional media companies. That's one issue, and I'm no expert on that. But they also have a contract. Facebook have a contract with their users, a social contract, which is much bigger. You know, this contract says, Facebook says, we're going to give you this magnificent platform. It's you can get whatever you want, you can share it, and here's a new way to learn stuff. And in return, we get your information and we monetize that and become very, very rich. That's worked incredibly well for them. They abrogated that responsibility, is enormous responsibility that comes with that. In my view, that's a social contract that they've broken. It's highly unethical. It's very damaging because many, many people rely heavily on that. Many people in this country, many people in the region rely on Australian news they get from Facebook. You know, we're in the middle of a once-in-a-century pandemic. We're rolling out a vaccine. Could you get any less responsible than Facebook's actions yesterday?
Well said. Brendan Crabb, thank you so much for joining us today.
My pleasure.